Thank you for your kind words and good morning, everybody. At the outset, I like to uh, thank for the blessings of our seniors, Dr. Sushil Jinder sir, Dr. Banjal sir, Dr. Bhardwaj sir, and Dr. Sunil M. Jain sir. And as sir has very rightly pointed out about the relationship between diabetes and cancer, although diabetes is itself very complex, we are still digging up a lot of theories in pathophysiology of diabetes. And with cancer also, I think the reasons are same. So definitely I will try to touch upon few things about diabetes and cancer. They look quite common, look very simple, but lot of complexities are there between the exact relationship of a neighbor or a mother or a sister with diabetes. So I'll just try to make it very simple so that we just know about these two epidemics which causes maximum number of mortality all over the world. So sorry, I have some technical problem here, so the slides won't be coming a bit as expected. So what is the connection? As sir was saying, that what is the connection between type 2 diabetes and cancer? We all know the basic problem with type 2 diabetes mellitus is the insulin resistance. And especially for we Indians, when we have more visceral adiposity, we have got more insulin resistance. And this insulin resistance is known to promote tumor progression. And along with this, hyperglycemia or uncontrolled sugar in type 2 diabetes mellitus increases the rate of tumor recurrence, the metastatic spread, and the fatal outcomes compared to non-diabetic people. Studies have even shown that a slight or a moderate increased fasting blood glucose level is associated with multiple fold increased risk for breast, stomach, and colon cancers. Now, when we are talking about insulin resistance, the main pathophysiology in type 2 diabetes mellitus and cancer, what is the correlation between this? We all know, friends, that hyperglycemia leads to non-enzymatic glycation of protein structures, and these glycated products release free radicals, cytokines, and growth factors into the circulation. And along with this, insulin resistance increases the risk for various cancers like breast cancer, pancreas, liver, colon, bladder, and oral cavity cancers. And this hyperglycemia is advantageous for increased DNA synthesis of tumor cell, so again helping them progress, and which again, as I told earlier, provokes deliberation of free radicals, which can cause, this is the main problem what I have read here, that there is a derangement in both the DNA and the enzymes which are involved in repair mechanism of our normal cells. This is a very good review published almost 5-6 years back, the relationship between hyperglycemia as a risk factor for cancer progression. As we have seen in earlier slides, hyperglycemia has been classically considered just as a subordinate of this cancer progression, whereas hyperinsulinemia is the primary causal factor for cancer, and a lot of studies have proven this, and it has been shown in this review. And how this happens, we all know that the cancer development through a ligand is by binding with the insulin receptors, directly or indirectly by increasing the levels of the IGF-1 or insulin-like growth factor 1. And these signal transductions are basically through two insulin receptor isoforms, the IRA and IRB. IRA recognizes insulin and IGF's special affinity for IGF-2, whereas IRB is insulin specific and is mainly involved in glucose homeostasis. So when this insulin binds with IRA, it exerts a direct pro-growth mitogenic effect. Then we have another problem. From morning, we are hearing about the obesity and overweight, which can lead to circadian rhythm problems, which can lead, or due to various chemicals, obesity can lead to various endocrine disorders. Now, obesity and overweight has also shown to increase the cancer risk and its progression, because obesity is a pro-inflammatory condition where we have increased number of cytokines like TNF alpha and interleukin 6, which are released from adipose tissue. On the other hand, we have estrogen and testosterone also, especially when we talk about estrogen levels in postmenopausal females. Their body fat becomes the primary site of estrogen synthesis, and the obesity in these females especially is linked to elevated estrogen levels, increasing their risk of breast and endometrial cancers. And along with this obesity, we have hyperinsulinemia due to insulin resistance, which decreases the liver production of SHBG or sex hormone binding globulin and increases the estrogen availability. In females, especially these postmenopausal females, hyperinsulinemia increases the bioavailable testosterone levels also, which is again linked to cancer risks. So these are various pathophysiologies we can see that how diabetes, hyperglycemia, insulin resistance, and obesity along with hormones increases the chances of various cancers. So now we'll talk about the clinical and molecular mechanisms favoring cancer initiation and progression in diabetic patients. Again, the reasons are same. Hyperglycemia, which provides energy for malignant cells, favors cancer growth and neoangiogenesis. We have insulin also. Again, hyperinsulinemia and insulin resistance promotes as a growth factor and has mitogenic effect, especially the A isoform of the insulin receptor we have seen in earlier slides. Studies have shown that type 2 diabetes mellitus has been positively associated with various cancers, especially the breast, colon, and pancreatic cancers. But there is an inverse relationship observed with type 2 diabetic patients and prostate cancer. And why this is? Because we know that lot of our type 2 diabetic males, they have low testosterone levels. So maybe this low testosterone level in our type 2 diabetic patients protects them from getting a prostate cancer. And again, I won't talk same thing, the effects of insulin and insulin like growth factor on various cancer progression and its causation. And now we'll see the epidemiological findings. That what are the epidemiological findings from various meta-analysis of a cohort, 12 cohort studies, which showed that there is a diabetes causes increased risk of all cancer incidents to the tune of about 1.14 for males and a relative risk of 1.18 for females. So here you can see that female diabetics are at a higher risk of getting cancers compared to male diabetic patients. Again, the cause is same. What we see in our type 2 diabetic patients. When we talk about the pathophysiology of diabetes, the chronic pro-inflammatory condition in our poorly controlled type 2 diabetic patients, where they have increased levels of interleukin 6, TNF alpha, C-reactive protein, and other markers of chronic inflammation. This all leads to genetic instability and increases the chances of cancer. So what we have been seen the association of diabetes and cancer is that we have increased circulating local or bioavailable insulin like growth factor 1, we have hyperglycemia, we have dyslipidemia also, increased circulating or local levels of estrogen, adipokines, and direct and indirect effects of various inflammatory cytokines. Now coming to the risk of cancer associated with diabetes or seen in diabetic patients. Various studies have shown the link between diabetes and liver cancer. A meta-analysis has demonstrated that individuals with diabetes had a twofold increased risk of hepatocellular carcinoma compared to non-diabetic, and this link was observed in both males and females. When we talk about pancreatic cancer, we have 3-year follow-up studies. Subjects with new onset diabetes showed that they had a higher risk of pancreatic cancer with a relative risk of 7.94 compared to people who do not have diabetes. And again, a meta-analysis of 35 cohort studies showed the same thing, that diabetes was associated with an increased risk of pancreatic cancer. Breast and other female cancers, again a meta-analysis including 20 cohort studies found an association between diabetes and breast cancer with a relative risk of 1.23. Another meta-analysis of 15 cohort studies reported an increased risk of 1.81. So these studies have shown that there is an increased risk of breast and other female cancers with diabetes. Then coming to kidney and bladder cancers, again meta-analysis have shown there is an increased risk of kidney cancer, a relative risk of 1.39, and here again females, they have a stronger correlation with kidney cancer compared to males. Colorectal cancer, again, meta-analysis showed a relative risk of 1.27 and consistent in both males and females. We have other cancers also. With diabetes, there is a 20% increased chances of gastric cancer. Again, a positive correlation was observed in female diabetic patients. And the problem here, again, they say, is the interaction of IGF or IGF-1 receptor axis with the vascular endothelial growth factor. Prostate cancer, as told earlier, that there is an inverse association. There is a impaired immune system in diabetic patient, where the host becomes less resistant to cancer progression and strengthens the metastatic potential of the cancer. So now we come to our drugs which we use in the management of type 2 diabetes mellitus, and the medications for the management of our diabetic patients have shown to be associated with risk for and mortality from a cancer in a German primary cohort study. This was a very good article published almost 10 years back, where the subgroup analysis of participants in the diabetes cardiovascular risk and evaluation study was done. This was a nationwide cross-sectional and prospective epidemiological study which recruited patients from German primary care, and it showed that type 2 diabetic patient had a higher prevalence of malignancies to the tune of 5.1% compared to non-diabetic who had 3% increase. So diabetic patients had more malignancies, and especially they said, I'm not dogmatically saying, but this is just an observation from this landmark study which showed that general and diabetic patients treated with insulin either as a monotherapy or in combination with other treatments had a 2 to 4-fold higher mortality rate than non-diabetic patients, and the mortality was 2.6% in diabetic patients with cancer, and it was just 1.2% in patients who did not have type 2 diabetes mellitus. So what they concluded was that there is an increased risk of cancer-related mortality, which is moderate among individuals with diabetes, relative risk of 1.25. And the main reason what they show was the obesity, which has got cancer-promoting effects, again, due to various theories I have shown you regarding the chronic inflammation. And when we talk about the medications, we know metformin we have been using since a lot of years, and we have it as a drug which should be started in all diabetic patients, and metformin has shown to lower the prevalence of various malignancies compared to other oral combinations. And this study, they have shown that compared to metformin, other OAD used or combination of other drug used had twofold higher risk of malignancies even after adjusting for possible confounders. So they showed that metformin has an anti-cancer effect. Various meta-analyses also of 17 RCTs have shown that there is a 39% decreased risk of cancer with the use of metformin, because metformin decreases cell proliferation and induce apoptosis in certain cancer lines. Metformin has shown to reduce the risk of colon cancer, liver cancer, pancreas, and breast cancers. So we should be screening our pre-existing diabetic patients for cancer. Especially studies have shown, and it is observed, that when the duration of diabetes is more than 5 years, we should start screening for various cancers in our diabetic patient, and it should be an individualized therapy if possible, because there is a high risk of developing certain types of cancer in diabetic patient, which is supported by a consensus report of American Diabetes Association and American Cancer Society also. And again, they have shown that there is a high risk of all-cause long-term cancer mortality in diabetic patient with a hazard ratio of 1.5. 0.41. Pooled RR of 1.56 for liver, 1.38 for breast, and 1.33 for bladder cancer. And non-significance was found for cancers of pancreas, prostate, kidney, endometrium, and non-Hodgkin's lymphoma. So what we should be advising our diabetic patients to cut down the risk of getting cancer, a healthy lifestyle, obviously, along with a good sugar control. So aim for a healthy level of body fat. So again, the obesity and excess fat should be minimized as much as possible, because it has been strongly linked to increase the risk of various cancer, which is again supported by American Institute of Cancer Research and American Cancer Society. And they recommend that people should be as lean as possible without becoming underweight to reduce the risk of cancers. Get daily physical activity and limit sedentary time. At least 30 minutes of moderate activity daily should be done. Focus on eating vegetable, fruits, and whole grains. Especially, it should be plant focused eating pattern which supply dietary fiber, nutrients, and phytochemicals. And we all know that vegetables and fruit provides fibers, nutrients which are vital for DNA production and antioxidant protection. Phytochemicals, they intervene with the cancer process by activating the expression of tumor suppressor genes. We should be eating more vegetables and fruits which are rich in carotenoids and vitamin C, and use more cruciferous and garlic, onion family vegetables. Again, the ACS and AICR recommends that whole grain should be our primary choice and advise us on minimizing the refined grains, and dried beans and peas should be replaced by all or part of the meat in some dishes. Few words about the limiting red meat and processed meat. Meta-analysis has shown 17% increased risk of colorectal cancer per 100 gram of red meat consumed because of its higher heme iron. And processed meat increases risk of colorectal cancer with 18% increased risk for each 50 gram of processed red meat consumed. Limit or consume alcohol in moderation, because alcohol has shown to reduce the insulin resistance and risk for diabetic patients. But on the other side, if it is taken in excess, it increases the risk for colon cancer in men and breast cancer in pre and postmenopausal females. And in few females, they may increase the risk for liver and colon cancers also. So this is my last slide. Still, as Sethia sir has pointed out in the beginning, the mechanism of diabetes and cancer link is just being hypothesized. We really don't know that diabetes increases the risk of cancer, or maybe cancer is the earliest sign of getting diabetes in individuals. So this is a basic problem of chicken and egg, or which came first. But few has been hypothesized, like insulin and IGF-1, inflammation and hyperglycemia, which may promote the progress of cancer cells. Metformin is the only drug which has shown to reduce the chances of cancer in our diabetic patients, whereas few studies have shown that insulin or insulin secretagogues are likely to develop cancer in our diabetic patients. Thank you.